Yes, so thank you very much, Rosie and the organizers for inviting me to talk, especially talking after the two people that have spoken now, who have shared their experience on HIFU in Africa. So I'm just going to look at what we can do in Nigeria and in Africa about HIFU. So I'm talking about understanding the HIFU technology, but I'm not going to talk so much about the technicalities. I want to talk about the clinical impact of gynecology in Africa, of HIFU on gynecology in Africa, with emphasis on uterine fibroids, and just mention a little bit about adenomyosis, and then also with drawing a parallel to my first love, which is infertility treatment. Yes, first and foremost, warmest wishes from Lagos. These masquerades are known to be associated with Lagos, and so I bring good tidings from Lagos and from the Fibroid Care Center at Nordica. Uterine fibroids are the most common benign pelvic tumors in premenopausal women, and in Africa, the approximate lifetime risk is about 70 to 80%. There are many management options for fibroid-related symptoms, which include expectant management, like the medical treatment, and then you have the non-excisional, non-surgical procedures like uterine artery embolization, and of course, our beloved HIFU, and the old-fashioned surgery, myomectomy and hysterectomy. Of course, this can be either to cut or to do laparoscopic surgery or hysteroscopy. We'll try to talk about a little bit about, mention a few of those things. Well, we know that fibroids are the commonest benign tumors in women, with the preponderance among Africans, like my friend Raymond alluded to. I'm going to try to look at the works that have been done in Nigeria and try to see how we can marry it with, because my thinking is that we have a big tool on our hands that can help us to fill some of the service gaps that we have in Africa, okay? So it's like something that's been hidden from us for a very long time, and I think now that we find it, it's a good way to see how we can use it. When we talk, there was a survey in one of the teaching hospitals in South Nigeria, which reported that fibroid surgery accounts for about 7.1%, that fibroids account for about 7.1% of all gynecological admissions and 21% of major gynecological surgeries. The interesting thing, just like was seen in South Africa, is that majority of these cases were between 30 to 39. We're going to see why some of these things are important as we go on. And the commonest mode of presentation was heavy menstrual bleeding, lower abdominal mass, and dysmenorrhea. Another study from southwestern Nigeria showed that the common presenting complaints were menstrual irregularities, abdominal swelling, and infertility, and also measured the average uterine size at presentation, and the majority of these women had multiple fibroids. This has been one of the things that had been the nightmare sometimes about us and HIFU, thinking, okay, multiple fibroids, can HIFU really take care of it? And I'm so glad that Professor Ahmed has spoken about this, but I'm going to dwell a little bit more about this infertility. There's always been this debate about what is the relationship between fibroids and fertility. So one of the best papers I could see on this was released earlier this year by Edgardo Somigliano from Milan. And he looked at the relationship between fibroids and natural fertility. It was a systemic review and meta-analysis. Well, the conclusion was that, yes, the epidemiological studies suggest, but they do not demonstrate that fibroids may interfere with natural fertility. That is, there's an association, but why this is so, we don't get it. Given the high prevalence of these lesions in women seeking pregnancy, further evidence is urgently needed. That was the conclusion from Edgardo. and his team. But I think one of the things we're going to talk about at the end of this presentation might just point out to some of those things that probably is hidden that we need to uncover. Now, I try to look at the effects of fibroids on IVF, okay? Because this fertility, to many people, they think Africa, that the problem of Africa is that we need to control childbirth. But they are missing the point that a lot of Africans also cannot have children. And so fertility treatment is also something that is gaining so much ground in Africa. And so we have to look at what is the effects of fibroids on IVF outcome. There's always been a debate, but there's a lack of gold standard to see which fibroids needs to be removed. Because just like we don't know how fibroids and infertility, it's like the chicken and the egg. We don't know which one came before which. But there was a study that we did in my center here in Lagos, and we also leaned heavily on the work of Elizabeth Pratt from the US, who did a big meta-analysis of fibroids and IVF and concluded that the position of the fibroids, it's very important, whether it should come out or you can debate whether it can stay or not. And we agree that with that, that all submucous fibroids should be removed. But one of the most pragmatic publications on this, it's one by Sandogan and Sandogan. One of them is in Turkey, the other one is in the UK, and they had this paper together. And they pointed out the importance of location, that is, whether it's submucous, whether it's intramural, whether it's subserous. Just like the paper of Pritz also said, and they concluded that all submucous fibroids of any size must be removed, whilst intramural greater than 5 cm has to be can be considered for removal. Subserous can be left alone, except if it's going to disturb your egg retrieval, then you really don't need to chase after it, because also the paper from Pritz has shown that even when you remove this, it has no effect on your treatment. In fact, talking about intramural fibroids, after removal, there's not been any evidence to show that there's improvement in pregnancy rate. And that's one of the things I think might just give a window to HIFU in this place. Because, you know, just like we pointed out earlier on by Raymond, that there's destruction of the musculature of the uterus when you do myomectomy. And HIFU tends to spare the muscles. So this might just be what we have been waiting for. I hope these are things that I think we need to look at and do studies on as time goes on, especially for us in Africa, where fibroids, it's very, very popular and common. When we look at the treatment of fibroids in Nigeria, myomectomy is the commonest surgery for fibroid treatment in Nigeria. There was a study from northern part of Nigeria which showed that as much as 75.6% of surgeries from fibroids was myomectomy. And in southeastern Nigeria, it was as high as 90.3% of surgeries for fibroids. This is not surprising, because we have seen that majority of the people who have fibroids and are willing to do something about it, at the back of their mind is their fertility in Africa. And just like when Raymond was talking, he said about 53% of their patients actually had presented us with infertility. There was another report from southeastern Nigeria where they were looking at what are the complications that come from myomectomy, this very common surgery that is done in Nigeria. And this was very scary, that they had about 86% transfusion rate post-myomectomy. And about 25% of the surgeries were complicated by severe hemorrhage, and post-myomectomy anemia was about 24%, and there was actually a severe mortality from severe hemorrhage. These are pointing out maybe this might look a little bit scary because it was from a teaching hospital. So you probably have some people who have been trained to become gynecologists doing this. But this is the stark reality of what we're confronting from fibroids in this part of the world. But there was also another study recently which showed that postoperative complications is as high as 25% after mammectomy and as high as 29.3% after abdominal mammectomy. So we can see that this surgery, as common as it is not without complications. And therefore, there must be a way to look for something that might just be a little bit milder than what we're doing now. In another retrospective study from one of the teaching hospitals very near Lagos here showed that the commonest complication was still intraoperative hemorrhage requiring blood transfusion. So it's like mammectomy, it's a blood draining surgery. And the estimated mean blood loss was about 630 mils of blood. And they saw that the higher, the bigger the fibroids, the more significant the blood loss and the need for transfusion. Great. But apart from this, the complications that can come from the surgery, immediate post-op complications, hemorrhage and so on, there is also, from our own point of view of fertility, there is a problem that is also associated with mammectomy, which is the fact that you can have a lot of intrauterine additions, and which might in fact impact on the fertility of these patients. And we looked at that also in this in my clinic. We looked at about 900 patients who had hysteroscopy between 2005 and 2014, and we saw that open mammectomy was one of the highest on the list of surgeries that can lead to intrauterine fibroids and intrauterine additions, which of course complicates the fertility of these young women. So we also looked at what about laparoscopic mammectomy. I mean, we thought, okay, if we go from something very aggressive to something less aggressive, let's look at what laparoscopic mammectomy. And we reviewed the first 31 patients that we did here in my center as well. And all these are published papers. And we saw that about 23% of them actually had postoperative complications. Hemorrhagic complications are amounted for only 6.4%. Hematoma formation 3.2%, excessive hemorrhage, which led to open laparotomy 3.2%, and overall mean blood loss was about 399 mils. And 9.73, only 3 of the patients required blood transfusion with a mean hospital stay of about 2.77 days after laparoscopic mammectomy. So we can see from all this that there is a need for something, a game changer. And I think this is where HIFU comes in. And we can, though, yes, we have heard from Raymond, we've heard from Professor Ahmed. Also, we can also look at some other people who have done some things in other crimes. And so the paper that was released from Hong Kong recently was also very heartwarming, where they shared their first 1-year experience in HIFU at the Hong Kong Center, where they treated about 147 patients, 85 of them were fibroids, and 51 adenomyosis. And that is one thing that we are probably missing in Africa. We are diagnosing adenomyosis. And I'll just probably at the end of this talk just mention briefly about that. And we see that these patients were successfully treated as day case procedures in Hong Kong. And the mild postoperative complications such as skin burn, back pain, and temporary sciatic nerve impairment were the only things that were recorded. Of course, the Ajayi study, which was done in China, which included 20 studies, also showed the overall success rate of HIFU in treating fibroids and other conditions. Well, I'm not going to talk about South Africa again because Raymond has dwelt extensively with that, and because also Rosie warned us about time, so I'm just going to try to conclude in the next 2-3 minutes. So my conclusion is that when we look at the fact that the patients in Africa tend to present late with fibroids, and the variant in Africa is probably more aggressive in Africans. So they may be larger and more in number at presentation. But we have seen from the experience of the two gentlemen that HIFU is effective, safe, and has less complications than surgical management. Of course, Raymond told us about the advantages, which include the fact that you don't need general anesthesia, which in this COVID era is a big plus. No blood transfusion. And then the HIFU machine does not need too many disposables. So majority of the things are things that you can use and reuse again, which is very ideal for a continent like ours. But what are the things that we should look at? What are the things that are likely to come up from this? Well, one of the things is I so much love this opportunity that we are rubbing minds in Africa, because we need a lot of collaboration. We need a lot of hand-holding. I see this technology as something that will help us a lot and is appropriate for us in this part of the world, and of course in every other part of the world. But and we see people like Professor Ahmed trying to push the boundaries and the application to other things. One thing that we probably also need to, but I've seen that also presented in somewhere in Spain, is that we might need over time to be able to continue to combine HIFU with endoscopy. For example, for submucous fibroids, we might need to do a hysteroscopy to remove the submucous fibroids. Because we've said that most of our fibroids there are many. And therefore, so it's not unusual to have submucous with intramural and probably even subserosal in the same patient. So you might need to have a combination of forces in order to treat this. Yes, but I must also talk a little bit about adenomyosis. We see even from the presentation of Raymond that he said they were not treating adenomyosis. But I guess adenomyosis is currently underdiagnosed in Nigeria and Africa. But I stumbled on a paper from somewhere in Nigeria where they reviewed over 5 years the hysterectomy samples that were sent for histology. And they saw 232 samples. 81 of these had adenomyosis. That's an incidence of about 34.9. So it means we're living with adenomyosis, but we're probably not making the diagnosis. And when we look at publications now are showing that adenomyosis affect women's fertility. So one of the things that might be responsible for the association of infertility and fibroids might be this undiagnosed adenomyosis, which we probably just need to pay more attention to in future. I think at this point, I'd just like to thank you for listening. It's been so interesting for me to be here. And let me thank you for the HIFU team for allowing your guys to come to us in Lagos, because as we speak now, they are currently installing a machine in Lagos, and we hope to be able to start using them. So by the next presentation, we should be talking about our own experience with HIFU. Thank you so very much.